What are the symptoms of COVID-19? A lot of people with coughs or fevers might be stressing out these days because they are worried that they have COVID-19. But with cold and flu season still in full swing, and the spring allergy season starting up in the northern hemisphere anyway, there are plenty of other things out there that could potentially explain these symptoms. Now these days, a lot of people might be getting coughs or fevers and stressing out because they're worried they have COVID-19, the disease a lot of people are just calling corona or the coronavirus. And this is like totally understandable. The main symptoms for COVID-19 can overlap with those of common illnesses like the flu. And, at least in the northern hemisphere, it's still cold and flu season, and the spring allergy season is beginning. Meanwhile, it can be hard to even know if you have COVID-19. Doctors want several kinds of tests to confirm. It also can take multiple tests to know for sure that you don't have it. Even if you're tested and it comes back negative, some reports suggest that in as many as 15 to 30% of cases, that is a false negative, meaning you have the disease but the test didn't detect it. Which is why doctors may advise some people who get tested to self-isolate, even if they test negative. But knowing more about the symptoms of COVID-19 can give you some clues about what to do next if you start feeling crummy. First things first, if you think you might have the coronavirus or want medical advice, you should talk to an actual doctor. I am not that. If you have acute symptoms, like trouble breathing, pause all YouTube videos and call your doctor or the emergency room. Still, the available research does tell us a lot about what this disease generally looks like. The three main symptoms everyone's talking about are fever, dry cough, and difficulty breathing. Which makes sense, because this coronavirus is mainly a respiratory infection. Two major review papers, one in Travel Medicine and Infectious Disease, one in the Journal of Medical Virology, looked at symptoms across thousands of patients, mainly in China, where much of our early info is coming from. According to their analyses, close to 90% of adult patients present with a fever, and about 58 to 72% have a cough. Big range there, yeah, but this comes from doing statistical analysis. It means that we're 95% certain that the true number is in between those two numbers. Only the travel medicine authors looked at trouble breathing, and they found that about 46% of patients had that symptom. Now, the U.S. Centers for Disease Control lists these as the top 3 symptoms. But according to these reviews, fatigue and muscle aches are right up there with difficulty breathing, occurring in 29 to 43% of patients. Kids seem to have much milder symptoms in general. For example, the review paper from the Travel Medicine Group found that only 44% had fever, and just 22% had a cough. And there's some evidence that kids may actually have different symptoms, like more gastrointestinal issues, for example. Also, it's important to remember that among both adults and kids, many cases are pre-symptomatic. They already have the virus, but do not yet have symptoms. We still don't quite know what that means for how those people spread the disease, but it is probably not good. Likewise, we know that there is at least a small group of adults, and probably kids, who are asymptomatic, meaning they have no symptoms at all. In fact, a mathematical analysis published in mid-March, which looked at early cases in China and how COVID-19 then spread around the world, estimated that up to 86% of cases were mild enough to go undocumented. That doesn't necessarily mean asymptomatic, it's just not like, I need to go to the doctor, bad. But the illness, of course, can still become very severe, especially when the fever, cough, and trouble breathing combo turns into pneumonia, where the lungs become inflamed and fill with fluid. By the way, you may keep hearing that older patients and those with pre-existing conditions are more at risk, and that is true. But even younger, healthier patients can develop pneumonia, which ain't nice. The two papers found that in 15 to 33% of COVID-19 cases, the pneumonia can progress to acute respiratory distress syndrome, where fluid buildup leads to a severe shortness of breath that can be fatal. That's why having enough ventilators, which help people breathe, is so important. None of these symptoms, of course, are surprising. There's a good chance you've heard all of this before. But there are the rarer symptoms, too. The paper in Travel and Infectious Disease didn't specify numbers for these, but the other group found that about 11% of patients had a sore throat, 8% had a headache, and 6% had diarrhea. This is where you start to see how research on something as new as this coronavirus can be tricky. Both of the review papers we've been talking about only looked at studies released through the end of February. But some of the more recent research seems to disagree about how common digestive symptoms are. In a study that followed patients through March 18, researchers in China found that of 204 hospitalized patients, half had digestive symptoms, loss of appetite, diarrhea, vomiting, or stomach pain. And even if you don't count loss of appetite as a digestive symptom, 19% of the patients still had GI issues.